If you're having an allergic reaction, you need to act fast with an epinephrine auto-injector, or EpiPen. These devices are quick and easy to use. Here's how they work. First, take the EpiPen out of the carrier tube and hold it tightly with your fist so that the blue safety cap is pointed up and the orange tip is pointed down. An easy way to remember this is blue to the sky, orange to the thigh. Remove the blue safety cap by pulling it straight up. An EpiPen is designed to go through jeans, shorts, and other clothing, so gently place the orange tip against the middle of your outer thigh to prepare for injection. When you're ready, swing your arm out and back to jab the EpiPen into your thigh. You'll want to make sure you keep your legs still when inserting the injector. If you hear the EpiPen click, that's a sign that the medication is being injected. Hold the EpiPen firmly in place for at least 3 seconds to make sure all of the medication is completely delivered. EpiPens are single-use injectors filled with specific prescribed amounts of medication. Using one will help you reverse a life-threatening allergic reaction. Sometimes your symptoms can return. If you have a serious allergic reaction that requires the use of an EpiPen, call emergency services immediately so that medical professionals can safely monitor your recovery.